Made to Move Physical Therapy, we're going to talk about the cross leg stretch. This is going to stretch our hip. It can be used for back pain, hip pain, knee pain. We're going to go through. First thing we're going to do is sit in the chair, cross one leg over the other. A big thing that we see people do is keep their leg too far out or too far bent. It's straight. And then our ankle isn't here. It's all the way across. So we want to take the ankle joint out of it. Once we get in this position, we can be caught up here. We want to be able to push that knee down to get a good stretch through the hip. Also, we can try to bring our nose to our knee to increase the stretch as well. You're going to push down. You're going to hold that for about a minute, and we can do that throughout the day or use it as part of our warm-up. That's it. All right, Made to Move Physical Therapy. We're going to talk about the standing pigeon stretch. This is another way to stretch our hip. I want you to use a table. It's going to be about this height, let's say about the height of your hip. You're going to put one leg up on the table. The thing we want to see is about a 90-degree angle between our thigh bone and our shin bone. We don't want it bent too much. We want as close to a 90-degree angle as we can. We want that knee to try to get down on the table. If you can get that knee down on the table and it's not much of a stretch, we can increase it by trying to bring our nose down towards the table, just above our knee. We can push down and hold it, or we can make it more dynamic by pushing down, doing about 10 to 20 reps to get that good stretch. Made to Move Physical Therapy, we're going to talk about a way to get some of the soft tissue in our glute area. This can help us with back pain and hip pain. So you're going to get a lacrosse ball. You're going to put the lacrosse ball on the ground. What I want you to do is cross one leg over the other. So the leg that's crossed, we're going to put that lacrosse ball on that glute. So put it right under your glute on the hip area. You're going to find the tender spot, and you can just roll it back and forth to try to loosen things up. And if you want to get some deeper layers in there, if that's not quite doing the trick, so my right knee, I'm gonna push my right knee down into the floor. So it's an active push. We're gonna hold that push for 5 seconds, 5, 4, 3, 2, 1, and release and relax everything down in there. So we're gonna try to get those deeper layers of that glute. And we would just hold that position until we felt like it loosened up a little bit. Spend anywhere from about 2 to 3 minutes on each side. All right, Made to Move Physical Therapy. We're going to talk about how to get some of the soft tissue in your glute released. It can help us with some of the hip pain and back pain that we might be feeling. First thing we're going to do is we're going to grab a lacrosse ball. We're going to get down on the floor. We're going to get this lacrosse ball right in the problem area, right on our glute. What I want you to do is the side that the lacrosse ball is on, we want to cross that leg over the other one. We can stay in this position, roll things out a little bit, try to release some of that tension. If you want to get a little more bang for our buck, we can push our knee, so this knee, we can push it down into the ground actively, hold that for about 5 seconds, and then we're going to release that tension in the leg and relax. What that hopefully allows us to do is get a little bit of a deeper of a rollout in her hip. Made to Move Physical Therapy. This is a stretch for the knees. What we're trying to do is try to get a deep knee bend. The easiest way to do that is we can do this on the floor, on a table. You can try to do it on the bed. What we're trying to do is trying to get our glutes down to our heels. So if we're sitting in a tall kneeling position, we're going to send our glutes back and try to put all the weight down on our heels. What you can do is spend 1 to 2 minutes in this position, try to hold that stretch. Can be a little bit painful. If it's too painful, we can get a pillow. We're going to use the yoga mat as a pillow to kind of prop ourselves up a little bit and release the tension just to start and work our way to not using the pillow. This can give us a good stretch to the knees, help us out. Made to Move Physical Therapy. We're going to talk about core stability and core strengthening. Exercise we're going to go through is the dead bug exercise. Going to get on the floor, preferably. lay flat on your back. Next thing we're going to do is we're going to get both knees up, get them as straight as possible, try to get a 90-degree angle between our trunk and our hip. Once we get that 90-degree angle, we're going to try to get our knees as locked out and straight as possible. Then we're going to point our toes up towards our nose. We're going to get our arms straight, palms facing each other, shoulders down to the deck, trying to hold this position for about 20 seconds, try to work our way up to holding it for about a minute. Made to Move Physical Therapy, we're going to talk about deep ab bracing, and we're going to show a progression here. You're going to lay flat on your back. What we want to do here is try to push the small of our back down into the table. What we don't want to see is the head lift up. What we don't want to see is the hips, the pelvis lift up. We want it to come just from our abdominal muscles, pushing straight down. Once we hold that position, if we want to make it a little bit harder and progress, we're going to kick one leg at a time, always having a leg flat on the table. The second progression would be to lift both legs at the same time and holding our abdominals, small of our back flat. And the last level is both legs up and like a bicycle kick. What you want to think about with the kicking is the lower we go, the harder it will be to stabilize. So we're going to start high kicking and work our way down. Made to Move Physical Therapy, we're going to talk about the bird dog exercise. You see a lot of this in yoga. First thing you do is you're going to get on your hands and knees. What we want is we want a neutral spine. So we don't want rounded forward. We don't want it too back. We want a neutral spine. Once we can hold that neutral spine, you're going to try to lift one leg and one arm at the same time without compensating. The key here is be able to stabilize and hold that position and alternating. The biggest faults that we're going to see is people rotating out as they lift. We don't want to see that. We want to make sure that you can stay as stable as possible without rotating. That's the bird dog. Made to Move Physical Therapy, we're going to talk about the prone press-ups. First thing we're going to do is we're going to lie on our stomach. The baby stage, the stage 1 level of this, is just to push up on our elbows. What we can do is we can do about a set of 10 of these, really focusing on getting some extension in our lumbar spine, which is that lower part of our spine. If that's not a big enough stretch for you, we can go up onto our hands. Go. The biggest fault that we see is our hips will lift up off the table. What we don't want to see, let's redo that one. Made to Move Physical Therapy, we're going to talk about the prone press-up to get some extension through our lumbar spine. The first level, the first way to do it is just pushing up on our elbows. We want to make sure and keep our hips down. So if you look at the front of your hip and you have that big bone here, or your belt loop, that's supposed to stay on the table and not raise up. So we do about a set of 10 to 20, trying to get some extension in that lower part of our spine. If that's not stretchy enough for you, we can push up all the way through on our hands. And again, trying to keep those hip bones on the table, keep our belt loop on the table. Do about a set of 10 to 20, really focusing on extension to that lower part of our spine. That's the prone press-up. Made to Move Physical Therapy, we're going to talk about the facet gapping stretch. This is going to get some rotation in our spine to help loosen things up. First, we're going to get in a sideline position, so just laying on our side. Our top knee is bent to 90 degrees. We want to make sure that knee is touching the table. We're going to use our left arm to keep that knee flat on the table, not let it raise up. Once we get there, we're going to rotate away from the knee. We can do a couple different things with our arm. We can put it over here to about 90 degrees to get some rotation. We can keep it out If you're having a little bit of pain with that, we don't want pain, we just want a little bit of stretch. We can keep the arm to our side and rotate. The thing you want to focus on here is your breathing. So as we breathe in, our spine is going to get longer, and as we breathe out, we're going to relax and try to rotate more into the stretch. So we breathe in, get a little longer, breathe out, go deeper into that stretch. Now hold that position for about 1 minute to 2 minutes. Try to do both sides. Made to Move Physical Therapy, we're going to talk about techniques to stretch your hamstrings. What we want to do is we find a surface about level with our hip or something where we're going to get a good stretch. We're going to square our hips up to the surface. We don't want to be rotated to the left or right at all. Once we square our hips, we're going to lift one leg up on the table. In this position, just having my chest upright may be a good stretch. If not, we can do multiple things to try to stretch this. We can try to flex our neck, bend our neck, and bend our back, and try to stretch it that way. You can either hold it or make it dynamic. We can also just reach with our hands for our toe. Again, you can hold it or make it more dynamic. Again, we don't want to see you rotating off. So if my left foot needs to be pointed straight the same way my right foot is pointed, straight and parallel. We don't want to be rotated out and then stretching this way. So square up, bend forward, hold it, or make it dynamic. It's a good hamstring stretch. Made to Move Physical Therapy, we're going to talk about rolling out the whole calf complex and how to loosen up that soft tissue. So the first thing we do, we can lay on the ground and get a lacrosse ball. You're just going to find those tender spots and roll the lacrosse ball using the ground kind of as leverage. What we don't want to see is somebody pointing the foot while they're trying to roll it out. We want to keep that foot nice and relaxed and try to roll some of those tissues out. If we need a little bit more pressure, we can cross one leg over the other, and that can get kind of nasty. Another way we can hit some of those tight spots and trigger points is we find a place that feels tight or that feels a little gunky. We can put that lacrosse ball right there in that spot, bend our knee until it's pretty wedgy there, pretty good, and then lift our hips off the ground and try to put more pressure into it. That's going to hurt pretty good. I would hold that anywhere from, 10 to 30 seconds. Try to find a couple tender spots and work those spots. That's how you roll out the calf. All right, we're going to talk about getting some of the soft tissue in the back of our shoulder. A lot of our rotator cuff muscles are back here. We're trying to loosen up some of the stuff. So there's two places that we can put it. We can put it right on top of the shoulder blade, or we can go slightly inside of that and get some of that tissue. We're going to use a lacrosse ball, put it up against the wall, and try to roll some of those tissues out. If we need to get more inside the shoulder blade, we can bring the same arm that we're rolling out and bring it across to our opposite hip to get that shoulder blade out of the way. And again, you can spend some time rolling it out. If you find a real tender spot, you can push into the wall and try to loosen it up. Hold that for anywhere 10 or 15 seconds until that muscle starts to loosen up. So we can roll out the shoulder.